Good morning, Daylina. Okay, so today's session is on advocating for school health. Happy to see everyone here. Just a couple of logistics before we get started. All attendees are muted for this session, so please introduce yourself. I see a lot of people are already doing that. Delana, I apologize for butchering your name, but please, you can put your name and your who you're with in the chat as we go through the session. And then also any comments or thoughts you may have that you want to share. Be sure that you do not just host and panelists. You can do everyone on your list if you want to share with everyone, or you can just do host and panelists. But make sure you're sending your chat to the right person. If you have a question, please use the Q&A box. If you put it in chat, it might get lost as people are making comments. So if you can put it into Q&A, that's a little bit better. We are recording this session, and we will send out a link with the recording as well as a PDF file of the PowerPoints so that you'll have all the information on your speakers and what we share today. As I mentioned, I'm Michelle Smith, the State Coordinator for Action for Healthy Kids, and I'm also Communication Chair for Partnership for Healthy Texas. With me today are Joel Romo, who is the Vice President of Government Affairs for the Cooper Institute and Texana Public Affairs. And Joel is also the Chair for the Legislative Committee for the Partnership for Healthy Texas. And James Gray, who is the Senior Government Relations Director for Texas, representing the American Cancer Society Cancer Action Network. And we are excited to have Ruth Mesta, Chief of Staff for Representative Ben Leman, and she is joining us to share insights from the legislative viewpoint. So welcome to our presenters, and we will get started. Just a bit about Action for Healthy Kids. We've been around since 2002 when Dr. David Satcher, who was the Surgeon General at the time, declared we had an obesity epidemic. We had teams from across the US gathered in Washington to strategize on how we could have an impact on the epidemic through schools and help our kids learn to grow up healthy. Our Texas team has worked on everything from nutrition policy, recess policy, physical education. We've worked with districts and schools to help them with wellness policies for the past 20 years. You can visit our website where you'll find resources to support your work around nutrition, physical activity, and social and emotional health, both on campus and remotely. We've developed for both cases with our current situations. We also provide resources and workshops around school health advisory councils and wellness policies, as well as we have provided grants for nutrition and physical activity projects. So today we want to talk about advocating for school health. We're coming out on the other side of the pandemic, we hope, and all the issues that relate to that. But we have to make sure we're addressing all of the other health issues that impact our children, and that we're doing everything we can to keep them healthy and ready to learn. We have to move past just keeping them safe from getting COVID and focus on all the issues that they face, as well as the consequences that have come about because of COVID. Children spend over half their waking time at school. So it's imperative that we work across all levels to ensure our children have a healthy learning environment. At the campus level, there are different ways you can impact child health. Site-based committees make a lot of decisions about what happens on your campus. They're sometimes called campus advisory committees, but they're usually made up of staff and parents. This is one place that you can go to take concerns. You might even have a campus wellness team if you're working with Catch or some of the different coordinated school health programs. Developing a campus wellness team is one of the things that you want to do. And parent groups and staff can also be extremely supportive. At the district level, there are district school health advisory councils. And these are the key way to get into health issues at a district level. You also have district administration and parent groups that you can work with. And then at the state level, if you want to be engaged with the state legislature, There's also TASB, the Association of School Boards. We do have a state level TSHAC that works on things, as well as the Department of State Health Services, Department of Agriculture, and the Department of Education, which we work with all the time. So what do you say, what do you do, and when do you do it? Well, that's what our experts are going to help you with today. Right now, I'm just going to do a little bit of a highlight. When it comes to working with your school district, joining your district SHAC is going to be my first suggestion. The SHAC is mandated by state law. It should be made up of a majority of parents. And basically, a SHAC can talk about and make recommendations to the district and to the board on just about anything that impacts child health. There are other state mandates around physical activity, coordinated school health, and wellness policies that a SHAC can address. We will share with you where you can find information on SHACs, and since that's practically a whole webinar by itself, but today we want to just focus on the advocacy part. So here I've listed some questions that you can ask to get you started at the district level. And again, like I said, we'll be sending this in a PDF file, so you'll have these questions when you start working on SHACs. Because of COVID, and some SHACs have not been as active in the last year or two as they have in the past, but it's a time when they really should be the most active. We have had districts who want to reduce physical education and activity time to make more time for academics because of the concerns over learning loss. Nutrition departments are being challenged with supply chain issues and staff shortages, lower meal participation. All of these things impact their bottom line and their ability to provide healthy food for our kids. And students have been home a lot of the time, which means they've developed unhealthy eating habits. They've had less physical activity. So all of this means that SHACs really need to be focused on helping districts move forward in ways that respect child health and recognize that we need to focus on these issues and play a role in their success. SHACs bring people together for school health, as we mentioned. We must learn from what we've experienced during this time of crisis to be better prepared for the future. It's time to reevaluate our priorities and bring focus to what matters most, our families and our health. Without health, nothing else really matters a whole lot. So if you are school staff or a community member or a parent, please consider joining your district SHAC if you're not already a member. Help them by meeting with school administrators and start developing plans that address issues, not just short term, but also future issues that you know the kids are going to be facing as we move forward. There's a quote from Margaret Mead that I feel is very applicable to SHACs. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So we need to work at all levels, but it really makes a difference if there's a policy that encourages districts to bring some focus to school health, which is why we have quite a few policies that relate back to school health advisory councils. Districts can get very focused on academic success and forget that health is sometimes one of the key things that makes kids successful. But our legislators have really full plates and they can't keep up with everything and be knowledgeable about everything. So we need to make sure that they understand all the issues and the impact health has on children's success. Joel and James are going to talk about a lot more about how this works. But I just want to encourage you one more time to identify who your legislators are, contact them, ask to meet with them personally, or email them, share information with staff members, find out who works on health policy, and let them know what a SHAC is and how important they are and the good work they do. So when next session comes around, they will be supportive and not feel like SHACs are just another unfunded mandate that's another burden on the school districts, which is something we've heard a lot in the past few years. Also, I want to encourage you to join our newly forming SHAC network. We've been working on this since last summer. We have about 200 members so far, but our goal is to have members in every district in the state so that when the next session comes up, we have a way of reaching out and letting districts know what kind of legislation is coming down or give them an opportunity to support a legislation that we're working on. We have just completed these three resources around SHACs. We have a work group that's been working on things that are SHAC related ever since the pandemic started to try to support child health. And we did one that targets parents so that explains to parents why SHACs are important and encourages them to join. And then we did one that has information on, for new SHAC members that say you've joined now, what is it exactly that you should be doing? And then one that we can share for SHAC members to share with their legislators to give them a better understanding on the role of SHACs and why they're so important. So these three resources we're going to be sharing out to our SHAC network, and also we will be putting it on a microsite that we've just developed. So this hasn't launched yet. We hope to have it up in the next 2 weeks. Excuse me, the Texas School Health Advisory Council SHAC network. And it will have information on everything from evaluation tools like the WellSat, excuse me, or the School Health Index, all of the laws that impact SHACs and guide what your work should be, as well as data sites where you can gain information, how to join the SHAC network, and then different things around the whole child and all the information that you might find useful. So this should be launching. If you join the SHAC network, you'll hear about this, or if you're part of Action for Healthy Kids Texas network, we do a monthly newsletter, you'll be able to identify this website that way as well. So that's just a real quick overview. If you have questions around anything SHAC related, I am always available to answer questions or jump on a phone call, share more information, and we will share how to join the SHAC network and access the website as soon as possible. But for now, I'm going to turn things over to Joel and let him get started on talking about the hows and whys of state policy work. So Joel.
Thank you, Michelle, and thank you for the opportunity to be here and for everybody that's joined us today. Looking forward to this opportunity to kind of give you a little bit of background of the legislative process here in Texas, and then also, we'll have the luxury of having a staffer from Representative Ben Leman's office, as Michelle mentioned, that can give us a little insight on how the process works within offices, how offices work, and give us some ideas and some suggestions. But I'd like to go ahead and start with our little background in the Partnership for Healthy Texas, just to give you a quick little snippet if you're not familiar with the Partnership for Healthy Texas. Next slide, please. We formed since in 2006, we came together, various public health partners, to develop our mission in terms of developing and promoting state policies to prevent and reduce obesity. And how this came along was that many of us that worked with different organizations, we, during the legislative session, tended to all focus on a couple of different items, but were at the end of the day weren't able to move the needle on a lot of things, and decided that collaboratively, that kind of going back to Michelle's point, that a group working together could move the needle a little further, and we did. In 2006, we formed the partnership. And that next session in 2007, I believe out of the 6 priorities, we passed 5 of them at the legislative level, and I think 1 at the regulatory level. So this is our mission. Next slide. And this gives you a little background of who is at the table. And if you're interested in joining the partnership, feel free to visit our website, and there's a way there that you can sign up and receive alerts and learn more about the partnership, our legislative priorities, our process, as well as we're about to start working on our legislative priorities this summer as we develop our legislative agenda. So feel free to send your ideas there. Next slide, please. So we are in the middle of a legislative interim session. So the legislature adjourned after about 1 regular session and 3 special sessions. They finally went home in October of last year. And I know for staffers and lawmakers, that was a long 9 to 10 months of being in the Capitol, working on different issues. But now we have an interim. And what that means is that the legislature in Texas will not reconvene for a regular session until January of 2023. And just as all of our folks here on the call today are, part of a school or involved in a school, or lawmakers now have some homework assignments, and we as the partnership, we crafted some ideas for them to study over the interim, and that's what we call interim studies. And so the House has released their interim charges, everything from COVID issues to transportation to water to impact of COVID on schools. And so they will start interim hearings probably in the next couple of weeks and hear the ideas. And it's an opportunity for not only the partnership, but all those that are interested to come to the Capitol, visit with lawmakers and discuss these ideas and see if there's some type of policy or budget that needs to be developed. It also provides the opportunity to build a relationship with legislators. Even though Texas, you may get overwhelmed, there's 150 House members and 31 senators. Each one of them has an office in the Capitol, and each one of them has an office in their respective district. So this is a good time to build those relationships, especially with the turnover. It is a redistricting year, so we've seen a lot of retirements, a lot of folks moving on. I think we're going to have probably at least 20 or 30 new House members and at least 4 or 5 new senators, which is a large number. And so this is a good time to use this interim to, as we call it, cultivate potential legislative champions on these issues, whether it be physical fitness, physical activity, nutrition, something more closer to home that you may need for your school. This is a good time to start reaching out to lawmakers, not only in their district office, but maybe even in their Austin offices, because some lawmakers, and Ruth can talk to this, some of them have staff that are particularly focused on key issues. They may not be in their district office, they may be in Austin, but they're accessible. It's also a good time to go over data and policy recommendations and visit with staff and lawmakers about why a certain policy should be considered. Because come January, as Michelle mentioned, there are over 6,000 pieces of legislation filed. The process is very fast and furious. There's not a lot of time. When you come to Austin, they will give you a few minutes if you're from the district. But compared to now, when you can schedule a meeting in the district and maybe get 30 minutes to an hour with a lawmaker, or if you are in Austin, their offices are open and you can sit down and have a good, productive meeting with staff. And then the interim hearings are also, everything's online now, so you can watch a lot of these committee hearings from your laptop and find out, listen to testimony, provide some questions if you need to, work with your staff and give them some suggestions. So there's definitely a lot of opportunities to engage in the interim. What we also encourage folks is to start planning your legislative agendas in your respective organizations right now. They're going to be asking for ideas for the next session. And if your organization or professional organization that you're with or school is looking at a particular policy that needs some modifying or a new proposal, this is a good time to give them those recommendations. Make sure that they are perhaps supported by other groups. It makes it a little easier for lawmakers to pass a bill, work on an issue when there's consensus on a particular policy. So there's a lot of opportunity, as I mentioned here. There's Texas is unique in that, as I mentioned earlier, every state rep and every state senator has not only a Capitol office, but also a district office. That is not the case in other states. I have the opportunity to work in some other states, and some of them have just a Capitol office and maybe one staffer in there. And in Texas, the Senate's a little bit bigger in staff. They have more representatives there, more staff in their office year round. In the House, they may not have that. So you have one staff that may be the key person in the office that covers everything. But be reassured that all engagement with staff is just as important as it is engaging with your lawmakers, because as I tell a lot of folks, during a legislative session, these lawmakers spend more time with their staff than they usually do with their families. So it's a good time to get to know these folks. Next slide. So here's the legislative timeline. As I mentioned, interim committee hearings will begin this summer and go through the fall. At that time, they'll have to submit their recommendations to the leadership in the House, to the Speaker, and in the Senate to the Lieutenant Governor. From those reports become potential ideas for policy, as I mentioned, for the next session, or budget issues. If you're working on something, and it's a great opportunity to try to make sure your priorities are in there. The partnership submitted a list of items. We didn't get them exactly the way we wanted, but we have identified a few committees that we can go and testify and meet with lawmakers on these issues and try to get some of these priorities that we're working on the agenda for those committees for the next session. So we're sitting here right now in March, about to be April. Elections will begin. Election season will begin this fall, and November 8th is election day, and the next session is not that far away. They'll start filing bills in November of this year. They can file bills usually until, I believe it's usually the week of spring break. In March of that session is always a date that bill filing deadline is, and usually that's a big rush to file the bills. You want to try to get any bill or policy suggestion early so that there's time to work out any kinks, time to build support, time to make sure lawmakers make it a priority for that session. And you also want to try to avoid those last minute bill filings, because some of those bills may take forever to get through the process and get a hearing. But there's also amendments, but we're not going to go into the details there. But also, and then of course the session begins January, and they are required to meet for 140 days for a regular session. And constitutionally, the only thing lawmakers have to consider in those 140 days is a state budget. That state budget is I believe, we're about 220 billion, I believe. Maybe a little off there figures. Everything else is not constitutionally required to be addressed. So, average session, you're seeing about 1,200 bills that come across the governor's desk. So obviously, as SHACs are working on policies relating to schools or PTAs or school nurses or whatever organization is wanting to move a piece of policy, you are one of many that are trying to get a piece of legislation passed. So that is why these interim opportunities are much more meaningful to your efforts in terms of making sure you get the support early, get it on the agenda of lawmakers and leadership early. And, it's a good time to do this. It's an election year. Folks are going to want to talk to folks. It's a good time to be out there and engaging. Get your lawmakers to visit with them either in the district, or have them invite them to come to your schools, or many are going to be having town halls. It's a great opportunity to engage. So with that, next slide. I think that might be the last one for me. These are some resources for you to get involved. Obviously, the Partnership for Healthy Texas, Texas Legislature Online. You can find out who represents you or find the status of a bill. And then the Michael and Susan Dell Center for Healthy Living, that link there has numerous reports from the Child Health Status project that they have, as well as during the session, they have a legislative tracking system that tracks anything that relates to children's health issues is on this tracking that you can go and watch. And with that, I think we will also bring in our guest today with on how to affect policy. We have, as Michelle mentioned, Ruth Mesta, who is Chief of Staff for Representative Ben Leman. She will be joining us for an opportunity to give you a little bit of insight of not only what the legislature is like during the interim, but also how to prepare and what the roles of the staff and how important it is to visit with these folks. So Ruth, you can share there you go. Thank you for coming. Folks, we have Ruth Mesta, as I mentioned, with the Office of Representative Ben Leman. She has worked in and around the Texas Capitol since 2014, and she's worked in different roles with key lawmakers and currently serves as Chief of Staff for State Representative Ben Leman from House District 13 that covers the counties of Austin, Burleson, Colorado, Fayette, Grimes, Lavaca, and Washington counties. So just a little small district. Many of these legislators represent either, small portions of small portions of a big city or a large geographic area of the state of Texas. So Ruth, welcome and thank you for being here today. Do you want to give us a little bit of background about some of the work you do in the representative's office and the issues you cover?
Yeah, so thanks, Joel, for inviting me to be on here. I'm Representative Leman's chief of staff, but for the last 2 sessions, I was his legislative director. And I know Joel mentioned this, that a lot of times, especially on the House side, the staff in the House offices is a lot smaller than over in the Senate. And because Senate staff is larger, they're more specialized in specific topics. In the House, we kind of just pick up whatever we can, whoever's available usually, but we all dive into it equally. If there's an issue that one of us doesn't know, depending on the size of the office, if one of us is not familiar with it, like we can talk to another staffer in our office. I've worked on various issues for the representative, and they've ranged from education or bills to prevent human trafficking, bills regarding Second Amendment rights. It's just an array of different issues. And a lot of the bills that we have filed and passed, a lot of them have been constituent driven, and they've been issues that we would not have been aware of if it wasn't for constituents coming to our office or calling us about a specific issue. A lot of what we do is deal with constituent casework, where constituents have issues getting in contact with an agency, or they're just having trouble getting an issue resolved. And a lot of times we've learned that those issues aren't being resolved, or there is an issue because there is no legislation or there isn't a law that keeps these issues from happening. So it's definitely very important to reach out to your legislators, because some of the issues that you're advocating for, it may be something that they're not even aware of, or they're not aware that it's something that's going on in their district. So it's definitely important to reach out to our offices about those things. And like Joel mentioned, we do have a district staff. We used to have 4 staffers in our office, but because Representative Leman is non-returning, we just have myself in the Capitol office and then a district director in our Brenham office. And usually our district director handles scheduling in the district. And so if you ever wanted to have the representative or any representative come out to your school or to meet with you in the district, it would probably be a better idea to reach out to our district staff to set up that meeting, because the representatives spend most of their time when they're not in session in the district and going out to events and meeting with people and setting up town halls. And so it's better to meet with them in the off time during the interim. During the interim is when we prepare for the next session. This interim has been a little bit different just because we were in session for a very long time. Usually what happens, since Representative Leman's non-returning, where obviously our office is not doing that, but usually what happens during the interim is if we get input from constituents or stakeholders about issues that they want to see passed next session. And so during the interim is when staff will research these issues, meet with stakeholders and constituents to dive more in depth into what's going on, and then start drafting legislation. Because as of now, I know I've talked to several of my colleagues on our hall and beyond, they're definitely working on getting bills drafted. And so now is a good time to reach out about those concerns, because we can get them into our in-house legal, so they can draft these bills, and then that way we can also share them and show the bills to you to make sure it's something that will address what the concern is. And that usually happens up until probably like Christmas, is kind of what we did in our office prior sessions. Up until Christmas and even beyond, we're drafting legislation, getting ready for the session and gearing up to see what the agenda for the representative is going to be. And usually we narrow down the bills that we are going to prioritize and actually push. a lot of times we have several bill ideas that we just know will not move through the process, or it's just not the time to get them moving. But like I said, now is a good time to reach out to your representatives and let them know what your concerns are. It's also important, I know Joel mentioned this too, of providing data. I know for ours, like for our office, it was very helpful to have data that was specific to our district, so that we could see how that issue was affecting our district and how we could fix it. And so it's important to reach out and know that whenever you are reaching out to a staff member, we definitely are passing it along to the representative. I know a lot of offices operate differently, but for our office, at least, we would look into an issue, bring it to the representative, and then see if we could set up a meeting. With COVID this session, there was not a whole lot of in-person meetings just because the Capitol was closed for a really long time. But I know next session will be different. There are Capitol days that people come up to Austin for and advocate for different issues. And we meet with everybody that we can. The reps are usually very, very busy, so it's hard to get them to meet with constituents. And if you call an office and they don't let you meet with the representative, it's not because they don't want to meet with you. A lot of times it's because they just don't have the time. And when they go to the floor, we don't know what time they're coming back. And so it's hard to set up a meeting when they're in the depths of session, and it's really, really crazy because the time is unpredictable. But know that we will pass on that issue to the representative and let them know what's going on, especially if it's something that's affecting their district. There's a lot of really good resources to stay up to date on what committees are going on and what bills are hearing and how to set up alerts. Texas Legislature Online is a really good resource because it provides all the bills that are have been filed, and you can set up alerts for specific bills, and you can set up alerts for specific committee hearings. So if you're monitoring a piece of legislation and you're wondering when it's going to make it to committee, you can set up alerts through there. And you could also, if you are looking to research any specific issue, the Legislative Reference Library is another really good resource. But we're always here too. If you have questions, us staff, we are always eager to look into any policy. I know myself, I love reading about all the different policies and everything that's going to come up next session. And we always look through all the bills that are filed. So if you have any questions, do not hesitate to reach out to your state representative, because someone's always going to be there, and they're definitely going to be willing to help you with any issue that you have.
Ruth, a couple of questions. Any suggestions or guidance on when they meet with their lawmaker, when folks bring material? Is it good to have a one-pager? How much, how little? And also during the session, what's the best way to communicate with lawmakers? In my day, we used to have fax machines and people would fax things, so, that's the second part is, during the session, what's a good way to reach their lawmaker and make sure they get that information given their hectic schedule?
Yeah, so one-pagers are definitely good, because we usually, our office, again, I don't know what every other office's policy is like, but we usually scan those in and save them, and link them to our correspondence management system, which can show the rep if someone is asking him about it and he's on the floor. It'll link to his computer so that he can look it up if it's about a specific bill. But phone calls are really good, and also emails. The reps usually have a district email box set up, as well as their own email. That's just their first last name at house.texas.gov. And those are monitored all the time. And sometimes, I know our office had this set up, but it's just an automatic message that lets you know that we've received your email. But we check those regularly. And so that's a good way to also reach out to your state rep. And if you're in the Capitol, give them a call, ask to see if you can meet with him or if you can meet with staff.
Right. And just, I think for clarification, can you give us an example when lawmakers have busy days? You know, are they in one committee all day, or is it numerous committees? And I know committees sometimes reconvene after the floor proceedings, and that's when you just don't know their schedule. Can you just kind of give us a little or insight on that?
Yeah, so sometimes at the beginning of session, it's a lot easier to meet with your rep, even when they are in session, just because there's not a whole lot going on the House floor, but there is a whole lot going on committee-wise. And so that's a more sort of stable schedule. But even so, once bills are referred to committees and there are hearings set, the hearings could go like range from anywhere to 2 hours to like 10 hours, depending on what sort of legislation is on the agenda. And so you just never know how long it's going to take. And like you mentioned, sometimes they meet right after the floor. So they have like 10 minutes to get from the floor to a committee hearing. And then again, depending on what bills are on that agenda, that committee hearing could be all night up until like the wee hours of the morning. So it's just very unpredictable what times they're going to have. Sometimes committees, if they know that they're going to be long, will take a lunch break or like a dinner break. And so sometimes that's a good time to set up meetings, but usually those breaks are a lot later in the night when there's not usually a whole lot of people in the Capitol. So
That's good to know. And just a quick, caveat. I remember we had a volunteer, I think, when James and I were working on some tobacco issues, and one of our volunteers from the Heart Association came in to testify for a committee hearing that was supposed to begin at 2 p.m. that day, and the House went to about 5 p.m. Then they started about 6 o'clock. Long story short, our volunteer ended up testifying at about 11 at night. So we not only had to find him a hotel room, but also toothbrush, because he just came and flew in for the thought would be a one-day trip, and it being an overnight trip.
yeah. And that's what we try to remind also, because we had some constituents that came in from our district this past session to testify on a bill. And then we had other stakeholders testify on another bill. And we just reminded them, like, just know that this hearing, yes, it says it's going to start at 10 a.m., but you could, and a lot of times too, hearings will start before they go to the floor. So if the hearing starts at 10, they go to the floor at noon. They want to finish that hearing before they go to the floor, and sometimes they can't. And so if it starts at 10, they go to the floor at noon, and they're on the floor for 2 hours, then the hearing can't reconvene until they're done. So then it wouldn't start until like 2. So we always try to remind constituents and anyone who comes to testify for a bill, just know that this is a tentative time and you may be here for several hours. So make sure to plan for it and know what you're going to do in case you are here for a really long time.
That's good advice.
Yeah.
So we've only got a few minutes left, but I thought I'd pick your brain on letting kind of an insight on what the 2023 session, what do you think may be a couple of key issues, as well as what the difference was, this session versus, or this past session versus this upcoming session in terms of access to the building and et cetera?
So the difference from this session to last session, like I mentioned earlier, for a really long time, the Capitol was closed to visitors. And then they did reopen, and I believe they were requiring masks. And I don't remember if we had a like capacity, but it was a little bit more difficult to come into the Capitol at the beginning of the session. And as the legislative session progressed and a lot of the COVID restrictions were lifted, it was open to the public and people were able to come in. So that was very different from previous sessions, to where just anybody could come in at any time. And I know this session, the Capitol grounds were closed after a certain time. I think it was 7 p.m. So no one could come onto the grounds. And I believe the Capitol building also was closed. So if you left, like, you couldn't come back in. But I believe this session, I think, is definitely going to go back to normal, to what it was before, of being more accessible. And allowing for more people to come in and more people to be up in the gallery. The last session too, the gallery was limited to the amount of people that could come in. They had spacing out between every seat just because of COVID. And I know the Senate required that people who met with senators had a negative COVID test to meet with them. I don't know if that's still going to be a policy next session. And I believe they got rid of it and then re-implemented it. So I'm not really sure what that's going to look like. And in the House, we didn't have that same policy, but I'm expecting for it to be more of a normal session. And then as far as policy priorities for the next session, I've not really heard a whole lot of what we can expect for next session. Committee, like interim hearings have started, or they will start in the next couple weeks. So that'll give us a better idea of what we can expect. I know that for the representative, for example, he's on energy resources, and I know we're going to be discussing some of the grid. And so I foresee that also being something that we see next session. And possibly, I know Human Services has been meeting in regards to the FPS. That's probably going to be something that's going to be on some of the priorities next session. But as far as hearing anything that's concrete of what we will actually be looking at, I have not really heard a whole lot. It's been very quiet in the Capitol because everyone's been enjoying the interim that took forever to get to.
Well, thank you, Ruth. And just so everybody on the call knows, these folks such as Ruth and both in the House and Senate staffers, they lead a pretty long day. Committees usually start at 7 in the morning, and as she mentioned, they go to midnight or 2, and then they start up again. And yes, sometimes it's only 5 months, but this year was about 10 months of this. So getting in front of them early, folks, is important, as indicated. And glad, Ruth, you were able to join us. Michelle, I'm going to sign off, and thank you for allowing us. And I'll be standing if we have any questions later.
Great. Thank you, Joel. Thank you, Ruth. Those are some great insights as to the whole legislative process in the state and dealing with legislatures and kind of understanding a little more about what they're having to deal with. So I have James Gray here to share some logistics and an approach to dealing with state legislator. It also can be used, I think, to deal with board members or school administrators. So I'm going to turn this over to you, James, and let you share some wisdom. This was part of something I learned a long time ago, and it really helped me when I first started working with legislators. So I'm hoping that you'll find it helpful as well. So
thank you, Michelle. And I just want to grab one thought from Ruth, and that is she mentioned staff are eager to learn and explore new issues, right? And I think that's the space that I would ask you to think about this presentation. I am with the American Cancer Society Cancer Action Network, and we fulfill the American Cancer Society's mission through public policy. So we work at the local level, we work at the state level, and we work at the federal level for really important reasons. And that is because I think lawmakers can do more to save lives than some physicians can just with passing a piece of legislation. And this issue, lack of physical activity, poor nutrition, obesity, contributes to about 1/3 of all cancers. So the work that we are doing through the partnership is really important for us to fulfill our mission. So what I want to do today is talk a little bit about who can lobby or advocate or educate, and then talk about kind of the setting that you'll be in, but then more importantly, give you some tools to use in that meeting with the member, with the staff person, and then just close out by just kind of reinforcing some of the kind of key points. My organization is a nationwide organization, but at the end of the day, our strength is in our volunteers. So we spend a lot of time using these tools, training our volunteers to build relationships with elected officials. And I'd ask you to think about, what I'm talking about in that context, right? So our volunteers range from doctors to university researchers to state employees that have been affected by cancer, but they're taking time from their work to be an advocate, to caregivers, to survivors, to individuals that have lost someone to cancer. So folks come to us with a lot of different backgrounds, but what they do have is a passion for our mission, much like you all have a passion for the mission of the partnership. So if you're kind of hearing all this and wondering, can I actually educate on this issue? Can I actually advocate on this issue? At the end of the day, you can, because you're a constituent. And sometimes educating is advocating, right? But you can, as a private citizen, be an advocate. And more importantly, you as someone that knows this issue as well as anybody in the state really should be an advocate, because you are a resource, particularly to elected officials who are looking for information on some of the issues that we're going to put before them. So let me give you a general sense of how to think about your meetings, right? And then I'll get into the tool that we use to kind of control that, that time with the member. It's really important that, when you are having a meeting, as you are thinking about building a relationship with your elected official, with school board members, with folks that actually have a position of power, your job is to really go in there and make yourself credible. But at the end of the day, you are trying to get an answer, right? They know that, you need to know that, they should be expecting that. What's really important to make sure meetings go well and relationships are built with elected officials is to be as courteous as you can be, so take politics out of any discussion, be as courteous as you can be, and then be honest. One of the most important things that I do as a lobbyist is, if I don't have an answer, I will let that member know, I'll let that staff person know, I don't have that answer. I don't know the answer to your question, but I will get back to you and I'll make sure I'm getting you correct information so you can make the right decision for your district. This third bullet, I think, is really important. I mean, you're in a meeting where the person you're meeting with probably has the power, but you probably know more about the issue that you're talking about than that member or that staff person. And they will come to appreciate that and they'll value that. But you need to know, as you go into that meeting, you probably know a piece of legislation better than they do. You probably know the impact on those you support or the community in which you live. And that's empowering and gives you some of the power, and more importantly, makes you a valuable resource for that legislative office. Ruth and Joel really reinforced this, and this is so important, but their time is precious. During the legislative session, it is such a chaotic time. You cannot even imagine. They are running 10 to 12 to 14 hours a day. A lot of what we're talking about can be done in district, as Ruth said. There's a lot of time to meet with members. They're back in district. They want to meet with constituents. Now is a good time to start those meetings. And then hearing Ruth should remind all of you that staff are as important in this process as anybody. I can tell you 90% of my time when I go into the Capitol was spent with staff. Staff care about these issues. They want to learn about these issues. They want to know about you. They want to know about their district. You can provide all that, and they are the direct line to the member, and are really just a valuable resource. And then here's the piece that is maybe done through the partnership network, but if you are getting feedback that the partnership should be aware of from a member, maybe they're thinking about a piece of legislation, maybe they've given you an answer on a piece of legislation or an issue, share that information, because that allows us as a partnership kind of lobby team to go back to that member and follow up with the information that you've identified. So next slide. What I'd like to do today, because I would imagine if you haven't educated or spent time with a legislator or school board member, someone that can actually influence some of the issues that you're working on, it can be somewhat daunting. We use what we call a hook, line, and sinker process in our organization to get our volunteers ready to have very effective meetings with lawmakers. And it's an oversimplified process that gives you some tools to help you think about how to go into a meeting that might be 15 minutes and capture the attention of that individual, and then more importantly, get an outcome from that meeting that's so important to the to the meeting itself. So Hook, line, and sinker consist of 3 elements. Hook is your name and kind of where you live, right? It might be, if you're talking to a state representative, my name is James Gray and I live just around the corner from that HEB over in this part of your district. And you've been my representative now for 10 years. But it's really establishing yourself with some credibility. It doesn't always have to be someone from the district. We can have very effective meetings with members, even if you're not from a district, but if you are, I think it's really important to reinforce that. So that's your hook. You've kind of got their attention. They understand why you're there. And then the line is your personal story, how this issue has touched your life, those you care about, your district, your school, your community, and talk about it in really simple terms. This piece of legislation is concerning because of this. And let me tell you about the impact it might have on our district. But also talking about why this bill is so important. Talk about some data, what you're seeing in your district. You are the expert of kind of what is happening on the ground, and they want to hear it. So really personalizing your story. And it might be you have a very personal story. So as a cancer survivor, you might say, I am a survivor of colorectal cancer, and this bill would impact me this way. But it personalizes it, and it kind of gets beyond kind of text on a page, and it makes the issue very real for elected official. Elected officials want to know, they want to put a face and a voice behind issues they're voting on, and the line is your opportunity to do that, right? And then once you do that, don't be surprised if the member starts or the staff person starts sharing their story. And then the sinker, and this is the most important part of the meeting, and that is asking the question, will you support, House Bill 1? And then you need to stop and listen. And let the member or the staff person give you some feedback. They might tell you why they won't support it. They might tell you they're not ready to support it. They might tell you they will support it. That it's really important that you stop and let them talk, because it's easy to feel rushed in these meetings. It's easy to walk out of this meeting and then not make the ask. And to be honest with you, representatives are so busy, they might not want to give you an answer. But it's really important in this sinker process to just stop and listen. So let me just transition to the next slide. So again, thinking about the hook is who you are, where you're from, localizing it. I'm from the district. But then the line is, again, personalizing the issue and talking about why this is so important. And I can tell you, with the constituents that I work with, which are primarily those that have been touched by cancer, this is very effective. But I've also seen this tool used by business people. I've seen this tool used on tax issues because it really, I think, gets beyond the data. It gets beyond the text on the bill and just makes it really clear that I came to you, I took time out of my life because this issue affects me this way. And that creates a very different conversation when you get to sinker, and that is they start thinking about what is their position. Well, I didn't know this would impact my community this way. I didn't know that someone in my community was affected by this piece of legislation this way. I feel differently now. I'm going to think about my position. I probably have a different answer because of what you just shared with me. It's a very simplified way of capturing the 15 minutes that you get with a decision maker. And this can work in almost any setting. And I would ask you, as you think about your meetings, consider the hook, which is who you are, why you're there, the line, which is why this issue is important, what's the impact it has on me or my community or the member's district, and then making that ask. Can I ask you, will you support this piece of legislation? Will you oppose this piece of legislation? And then let them speak. And you'll learn a lot from their reaction. And then let me just go to the next slide, which will kind of reinforce some of the things I've already talked about. Again, it's never, having worked with a lot of folks over my 25-year career as a lobbyist, the power in constituents, educating and advocating is really what has made the difference on so many issues, so many important issues that we work on. For example, this last session, there were only 3 healthcare insurance mandates that were passed. One was a bill that we worked on because we brought volunteers into the Capitol that were survivors, and they were able to speak with elected officials and personalize this issue, which made all the difference, right? So again, never forget when you're in the office to make that ask. Be courteous and as honest as you can. If you don't know an answer, it gives you a chance to follow up with that office. Members will appreciate that. And then most of the time, remember, on the issue, you probably have more information than they have. And you are creating, you are developing yourself as a resource for that elected official. And if they don't agree with you this time, they might agree with you next time, right? Remember, their time is precious, and their time might be just as precious in district, but expect a short meeting. It's interesting, I've had volunteers tell me they've had these meetings in district and grocery stores, and hook, line, sinker works really well in a setting like that, right? It gives you a chance to quickly state the facts and then make the ask, and then share your feedback. You are the feedback loop that we are hoping to develop. What you hear could really inform our work in the Capitol and make us even more effective. So again, thanks for the time to present today. Hook, line, sinker is a valuable tool. Get comfortable with it, and I hope you see value in it. Michelle, back to you.
Okay, oops. Thanks, James. I'm not sure what there we go. I didn't have my screen open all the way. It seems very simple, but I think it helps give you confidence if you know how to approach things, and it just is a really good reminder. And I can't reiterate the fact that stories, telling your story is so important. I have been in meetings where a legislator was listening to a constituent talk about how something had impacted their life, whether it was cancer or obesity or another health issue, or something that impacted their child's ability to learn in school. And those legislators will take that to heart. And the next thing you know, there's a bill out there, or they weren't supporting a bill, but all of a sudden they've changed their mind. So never doubt the importance of telling your story and making sure a legislator understands how personal it is. Thank you so much, James, for sharing your information. That was a great story. Just real quickly, we will share again the PowerPoint with you with these links. There are a lot of good resources out there for you. Department of State Health Services has a SHAC guide, which is very helpful. It's just been updated. Texas Education Agency has links to school health and the actual policies that govern SHACs. Department of Agriculture has a lot of great resources on local wellness policies, which is something that the SHACs can work on that are mandatory for any school district that is part of the federal school meal program. Then even Texas PTA has some great information on advocating and healthy lifestyles. If you're looking for specific policies, NASB has a policy database that has all the different states on it, and it's a great resource for looking at specific policies around different topic areas. And the CDC has some wonderful resources on school health. I go to their site regularly to find information on different topics around school health. An organization called the Center for Science in the Public Interest, or CSPI, has some great policy information as well as school food information. And then the School Health Index is a great assessment tool. Our organization has a modified version on our website. CDC version is available electronically, and this is something that can help you assess where your school is around different policies. So that is our presentation for today. We finished right on time, amazing. Just another real quick mention, we do record all of our webinars. in our learning sessions. And Texas has quite a few that are on YouTube. And there's a link that you can go to. If you're looking for something specific around parent engagement, social emotional learning, recess, different topics, outdoor education. So you will find, I think like over 50 on YouTube that are 1-hour sessions that you might be interested in investigating. So again, thank you for joining us today. Thank you, Joel and Ruth and James, for sharing your knowledge and spending your part of your day with us. We will have more webinars in the fall. I believe this will be the last one for this school year, but we will be adding a new set of webinars this fall. If there's a topic you feel we should be covering, just reach out and let me know, and we'll see if we can't work it into the agenda. So have a great rest of the day and hope to see you soon. Thanks.